Tonight we have another Go Public story, which we first reported exclusively on CBC Radio this morning. A BC woman suffering from Lyme disease who says doctors overlooked her symptoms, a delay that made her illness a lot worse. Kathy Tomlinson has the story.
Too weak to sit up. Marie McQuay was an active college student until Lyme disease took her down.
I started out just with a few simple symptoms, and then within a year, I'm completely bedridden and just in so much pain.
Over 2 years, doctor after doctor dismissed McQuay's suspicion she had the nasty disease. She remembered a rash she got hiking the West Coast Trail, possibly a tick bite, infecting her with bacteria.
I knew I was sick, I knew something was wrong.
When she eventually tested positive for Lyme in the U.S. and was diagnosed by a specialist, it was too late. She was too sick for antibiotics that could have cured her earlier.
Our healthcare providers are very biased about this disease. They don't want to acknowledge it.
Her parents couldn't believe it when doctors told them there is no Lyme in BC, despite government warnings that say there is.
If you have Lyme disease, you have to basically pretty much diagnose it yourself or through somebody else, a hairdresser that knows somebody that has the same symptoms. It's bizarre.
Well, the number of people in BC being diagnosed, confirmed using the BC tests, are only 5 or 6 a year. We believe that number is likely in the hundreds.
Lyme disease sufferers insist BC doctors don't know enough about the disease, and the tests here are substandard.
When they do get a diagnosis at one of these U.S. laboratories and they start getting treated for Lyme disease, suddenly their health is recovering.
Marie McQuay's parents are now spending thousands on various treatments from private clinics. None has helped so far.
You're helpless. Your hands are tied. You can do nothing.
So hopeless, nobody can help.
The Lyme Disease Foundation wants the BC and federal governments to pay for a research center to bring the testing and the doctors here up to date. We wanted to ask the BC Health Minister about all of this, but George Abbott refused our request for an interview. Kathy Tomlinson, CBC News, Vancouver.
So what are some of the early signs of Lyme disease? It can begin with flu-like symptoms, including fatigue, fever, headaches, a stiff neck, and overall aches and pains. And often, but not always, there's a rash. It begins as a small spot at the site of the tick bite, but if it's untreated, it can spread into either a circle, an oval, or bullseye with a red ring around a red center. And as the infection spreads, the rash can appear on different parts of the body. If you have a story you think should go public, you can email Kathy at gopublic@cbc.ca.